some time ago, and as with most decisions that are brave, they didn't probably realise it until now, because there's been quite a few bumps in the road and quite a few things that have happened to get us to this point. But they made a brave decision to say, look, we've got some reserves, we've got a whole stack of GPs that want to be innovative and want to be at the coalface of innovation, but we don't know what to do. At that point, what they've done is essentially put all their reserves on the line to make this happen, which is a pretty brave decision for anyone's business. To basically say, we don't know what to do, but we'll throw a bit of caution to the wind and see what happens. Both businesses, fair to say, weren't necessarily travelling in a very profitable way, but they weren't travelling backwards either. They just weren't probably achieving what they thought their members wanted out of their respective businesses. So they made this brave decision probably about 18 months ago, and I came on board about 12 months ago, and I think they suddenly realised how brave it actually was, and they started throwing the firm around to see if we could make this happen. What they did have, though, in both organisations is assets. Assets they knew they had, which could be shown on a balance sheet, things that I used to account for as an accountant many years ago. But they also had another asset that they hadn't really accounted for but knew it was valuable, and that was their membership. In other words, they had 1,600 members, I think GP Partners Australia has, and another 600 or 400 you guys have got. So they had these memberships and members that were connected to the organisation and knew somehow were valuable. How could they translate that value to reality? How could they deliver value to their members? So to give some context around that, the journey sort of led us to today. We've made quite a few mistakes along the way in terms of getting to this point. We've learned a lot. We've learned how to do things. Some of the really interesting things we've learned to get us to this point was that we know the health system needs to change. As much as IT promises to be the next revolution for healthcare, it does need to change. We're headed for a car crash if we don't do something around health to make it work. We know that GPs are a vital cog in the system. They're the front line of this problem. And that they perhaps haven't been as active in innovation as they should have been over the last few years. We also know that GPs perhaps don't have the capacity to necessarily implement a lot of their great ideas and solutions to problems that they see. They're too busy simply being GPs and dealing with the crisis that sits in front of them. They know innovation is needed, and even in a report that came out today, I think it was projected that GPs have already budgeted an extra 30% or so on their budgets to spend on innovation the next year or two because they know how important it is to their practices. We knew suddenly that we don't have the answers, but we do have some money and connections. So what we did was essentially create a national, connected and capable primary healthcare accelerator to make this happen. Instantly our members get to connect, or our investors, or investments I should say, get to connect to either over 2,000 GP members. And that's really important because what it does for a startup is much more than just give them money. What it does, it gives them a shape or a reference point to shape their product innovation. It also gives them an early distribution channel to market for their product or innovation. We expect to create probably about 8 high-value companies over the next 2 years to start, just to get moving and to get this whole practice in play. Our total investments in these companies will be around about 1.4 million to test the market to make sure we're doing things right. And we've got access now through probably some of the networks we've created to corporate partners and follow-on investment for those companies. What we've been able to assemble in a very short time is a pretty experienced management and a globally connected board and partnership group, which is kind of interesting with what we're up to. We've got partnerships also now with the state and the federal government around creating some difference. So the secret, I think, of our point of difference or innovation in general that I've learnt the hard way over many years is that the quiet asset of connections becomes almost the most important thing to have in the equation. It becomes valuable. And that quiet connection of connections, if you like, is what GP Partners has and is now going to use to actually give value to these startups. It means where we start where others hope to finish. If you think about that, we actually start the journey for a startup where people hope to actually see their innovation land. It's just going to be with GPs. Can they give me input? Can they give me some input to my innovation? Can they actually help me sell this to the market? We start there. By using our members, we tap into the ideas of our members, our problems that they have, we co-develop solutions, and therefore we connect with early distribution. We will also, along the way, interestingly enough, create some pretty good data around what's happening out there in the primary health networks and what's actually going down. The space is, and why are we doing this? The space we think, and we know now, is unique. We just spent a bit of time in the US. There's no one really doing this that's actually working from the market back in an accelerator sense. Most of the accelerators you see are almost extensions of education. They're universities that have decided to extend their entrepreneurial education out to market. We started the market and worked back, so we're quite unique. It's a key area of growth you've heard from Ash, both here locally and globally. We connect now GPs with innovation and the capacity for them to shape the future. They no longer sit there and worry about the future, they can actually help shape. And we've also, as I said, created those broader partnerships. To dig in a bit more detail, there'll be two companies, or we have created two companies. GP Accelerate, whose job really is to source and to manage and to grow these companies. We've also created another company called Health IP, which is take investment and invest in the companies. We've separated them for good reason, that is that we can attract third-party investment in Health IP, and it won't necessarily be tied with the management of actually finding and growing those companies. So how do you connect with GP Accelerate and Health IP? If you wanted to invest in a portfolio of companies, the way we'll structure things is to invest in Health IP itself. GPs are a good source of investment, so as well as their super funds and others. So we've got quite a range of investment coming in, apart from the early investment that our organisations are giving. If you want to connect with the startups of the network, just become a member of our accelerator and join in the networking events and do what you need to do. You might want to invest in one of the two startups, but you don't know which ones yet. You become a partner of the accelerator who will create options for you to invest alongside Health IP. Our success is really the success of the small companies that we invest in. If you're a startup or you've got a good idea and you want to explore being part of the accelerator, you can apply to the accelerator. We're open for applications now. There's a website that gives you expressions of interest, an expression of interest form on our website, and you're welcome to apply. If you're a GP and you want to get involved in new companies, then you're already connected by one of your respective organisations. Become involved in our events, and we've got a portal to feed in ideas, and we'll be using GPs to source ideas at the same time. So what we've done effectively, what we hope to achieve for our members or the members of GP partners in both Brisbane and Adelaide, is to connect them to the market. They can now influence health, influence how patients interact with innovation. They are the country's frontline, or become the country's frontline. They lead from the front. Will give GPs a voice in what innovations will work. Will give GPs the capacity to make a difference beyond their own patients, and recognise them as a group willing and alive in innovation, so that they can now participate in probably the wave that we're seeing. What do we hope for our investees, our companies that we might invest in? We kind of hope that we give them a value lift. Interestingly enough, we'll probably give the value lift just by investing, because their story before we invest is, I've got a good idea and I think it might address the health market. The story after we invest is, I've got a good idea, it might help the health market, and I'm connected to a market. I'm connected to GPs to help shape my ideas and to get it out to market. We obviously give them investment, we give them that initial market, we guide and shape them, we get some ownership and commitment from GPs from the start, we give them global exposure and connections, as you've seen with the likes of Allscripts and others around, and we give them partnerships with larger partners of the accelerator. Why does it work for people that want to invest, or our investors? We get the products quickly to market. We are a fast to fail or succeed. We're a consumer market. We add the market to the opportunity to increase its value on investment. We hold a portfolio of investments. We have efficient screening, and we have an investment that effectively doubles in the investee's hands. So how does this look over time for Health IP? If you actually run the clock forward, look in a couple of years, how will it look for our investment company that we're creating? We'll be creating probably 8 investees over 2 years. If we have a 75% survival rate with projections that we've worked on, we should see a value of Health IP of double, essentially, about 3 million. If we get a better survival rate, a worse survival rate, I should say, at a 50% survival rate, then we should see 2 million. We should see a return on assets of about 49%. It's quite a lucrative area, it's probably the message in the slide. So just to reinforce the point of difference I think about this accelerator and others is that, and it was summed up probably by the world's best ice hockey player, Wayne Gretzky, when he was asked why is he so successful. He simply said, I skate to where the puck will be. We start there. We start where the market starts and finishes, essentially. So with all good businesses, I'm happy to launch GP Accelerate tonight and thank very much the faith of both boards, the faith of GP Partners itself, its chair and Andrew Kelly and his team. I'd also like to thank the board of GP Accelerate for showing its faith in what we're up to and how we're doing it. But now's the time to really start. We're looking for companies to invest in. We're looking for partners to help along the way. It's a bit like, as Roseanne said at the beginning, we're a work in progress. We're more than happy to partner with anyone that wants to help and come along the journey with us. We're about to make some great companies, and we're looking forward to you guys helping. So thanks very much for your attention tonight, and I'll hand over back to Roseanne.
Thanks, Anthony. I don't think I really need to say much more other than to thank you all very much for being here tonight. We still have some more drinks and nibbles, so please stay and chat to the various directors and partners. And as was demonstrated, this is very much around demonstrating how partnerships can really enliven all the proponents, and we hope that you saw that there's a plethora of opportunities and different entry points for you to get involved in. So we look forward to talking to you more. Thank you.